This Wellness Wednesday, we are kicking off our first series of PD Solo, Alone but Not Lonely. Living alone, whether by choice or circumstance, poses many challenges for someone living with Parkinson's disease. Day-to-day needs, managing Parkinson's symptoms, and maintaining emotional well-being can sometimes be difficult. In this program, we will explore topics relevant to those going PD Solo and provide practical tips for living your best life with Parkinson's disease. So that is this Wellness Wednesday, March 16th. And you can learn more about that program, register and sign up to attend at parkinson.org/PD Health. If you have any questions at all during your journey through Parkinson's disease, something comes up in between doctor's visits, please don't hesitate to browse our website at parkinson.org. We have an extensive library of peer-reviewed, expert-written materials. You can also reach out to our bilingual helpline at 1-800-4PD-INFO or email us at helpline@parkinson.org. I'm going to open my chat and see what's going on in here. So we got John and Shirley joining from Michigan, Jenny joining from Illinois, Jerry from Davie, Florida. We've got somebody joining us from Wheaton, Illinois, Arizona, Nevada. Welcome, Lynn. New Jersey, welcome, Karen. California, perfect. Massachusetts, Virginia, New York. Welcome everyone from across the United States. So today we are going to welcome our expert, Dr. Taylor Rush, who's going to be talking to us about how we can start to cultivate a daily practice of mindfulness. And you give us some tips and tricks on how we can do that. Dr. Rush, I'll let you take over from here.
All right, thank you so much, Krista. It's so good to see everyone's faces today. I will say the sun is shining in Cleveland, and it's very exciting because that doesn't happen often this time of year. And so I plan on hopefully enjoying a little bit of it later today. So again, thank you guys so much for joining us today. I thought we might spend a little bit of time discussing the importance of cultivating an informal mindfulness practice. So we all show up to this meeting each week because there's a desire to learn more about mindfulness and how to develop a mindfulness practice. And we do that for all kinds of reasons, right? You know, we want to be able to maybe slow down how fast our brain thinks, or be able to learn better ways to relieve stress, or just to be able to overall live a higher quality of life. And so in the course of learning mindfulness strategies and different meditations and techniques, I think that it is really important to keep in mind that mindfulness is not just a meditation practice, okay? You know, it's very important to develop a meditation practice as you learn about mindfulness. And so formal meditation practices are when you actually set aside time to be able to focus on a mindfulness strategy. And we've done so many over the course of this program, right? So mindfulness of breath, mindfulness of your body, mindfulness of your thoughts. And, you know, but it's this secure time that you specifically dedicate towards mindfulness. But it's important to recognize that mindfulness is not just a practice, it's also an attitude. It's how we interact with ourselves and the world that can be carried over in between some of those formal practices. And the hope is that with formal practice, you are able to sometimes develop a little bit more of an informal practice. And so we've discussed this kind of tangentially in a few other sessions. So last year, we did a session on beginner's mind and being able to look at situations or circumstances with new eyes. And we also, I think, did one on mindful play and being able to engage in things that bring us joy and excitement and fulfillment and connection. And so to me, those two things are examples of ways we can incorporate mindfulness informally. And in my opinion, those informal practices are just as important, if not more important, than the standard formal meditation practices. And what we know from the research that's been done is that practicing informal mindfulness cultivates many of the same benefits of formal meditation in terms of stress management, emotional regulation, being able to interact with people and situations in a slightly different way. So let's talk a little bit about ways we can possibly incorporate mindfulness in these informal capacities. And so, the two overriding things that I will say that constitute an informal, mindfulness practice is doing anything that anchors you to your senses. So your sense of sight, touch, smell, taste. And so being, audio, of course, too, hearing. And so being able to connect to at least one, if not more, sense in any activity that you're doing. And that activity, preferably you're doing one at a time, because as we know, multitasking does not tend to work out too well for any of us. So setting an intention to do a task one at a time and really anchoring to the sensations and the experience of that task. So that can be just about anything that you do in everyday life. So it could be everyday mundane routine tasks. So like washing your face, brushing your teeth, getting dressed, drinking coffee, eating a meal, showering, brushing your hair, anything, that's part of your daily routine. I know for me, one that I do on a fairly regular basis is, Cleveland weather is not always kind to one's skin. And so I tend to use a lot of hand lotion. And so for me, putting on hand lotion and kind of rubbing it together and smelling it is a really grounding experience for me, just to kind of start the day and sometimes start each hour, depending on how dry it is. And so you can take any sort of mundane task. It could be making your bed or doing the dishes or wiping off the counters, even those mundane chores that we'd just rather get through quickly. We can sometimes really engage in those tasks and understand what it is to complete them. It can also be informally used in pleasant activities. So time that you spend in connection with people that you really enjoy being with, time that you may spend with your pets, time spent outside and in nature, or even time spent doing hobbies or recreational activities that you enjoy. Sometimes when we do these things, we're there and we're doing them, but then we're also kind of somewhere else. Our mind may be wandering to what's coming up next or what we've already done, or sometimes the worry train makes a stop or two with, things that are going on in our lives that are weighing a little bit heavy on us. And so we don't always fully engage in some of those tasks in a way that might help to enhance the experience of it in a good way. And then sometimes we can also informally practice mindfulness during activities that are difficult. And so this comes up with my patients who have Parkinson's when we talk about how to handle wearing off periods, or first thing in the morning when they haven't taken their medication yet, or it hasn't kicked in and they're feeling very stiff, or their tremor is worse, or they're feeling unsteady. And so being able to sometimes pick one or two sensory experiences to focus on in those moments that is not only the unpleasant sensation, and whether that's a physically unpleasant or emotionally unpleasant sensation, depends on the circumstance, but trying to broaden the horizon of the experience so that you focus on a few other things as well. And so being able to do this provides you with some flexibility to be able to enhance these experiences that you have in everyday life, and maybe notice new things about them that you hadn't noticed before, or maybe have a sense of gratitude or fulfillment as a result of doing those tasks that you would otherwise just kind of go through the motions with and not think twice about later. So really, in my opinion, the informal mindfulness component is what's meant to help to enhance some of that quality of our lives. And I will also say that when it comes to using mindfulness informally, I have a lot of my patients tell me that when they are exercising or taking a walk or in their physical therapy appointments, they find that using some of their mindfulness skills comes in really handy about, being intentional with how their body moves, how big their steps are, how their muscles are moving in different ways. And actually, at least here where I work at the Cleveland Clinic, a lot of our physical therapists incorporate mindfulness into their physical therapy sessions with our patients, which I think is super cool. And I think our patients definitely benefit from it. So I wanted to talk to you guys a little bit about, okay, how do we actually remember to do some of these informal mindfulness strategies? And because it's hard if you're not thinking about it actively, sometimes you don't remember that it's a thing you can do, right? It's just like, taking a deep breath every now and then often helps us to calm and, approach a situation a little better. But it doesn't mean we always remember to take the deep breath. And so, I think it's important to sometimes have some brief mindful check-ins throughout the day. And sometimes you can, create a reminder system where your phone buzzes at you, or you say, okay, when I take my meds, I do a mindful check-in. So you anchor it to an already established routine. And so, whatever it may be, but kind of inserting some mindful check-ins throughout the day to allow you to have some of these mindful moments with different tasks. And so I wanted to share with you something called the STOP strategy for mindfulness in daily life. Okay, so STOP is an acronym. And so S actually stands for stop. I don't know how I feel about the word being part of the acronym, but in any case, so stop, where you actually allow yourself to pause. T is take a breath. O is observe, just observing, what's going on in your mind, in your body. And then P is proceed with awareness. So figuring out, how do I want to set an intention for moving forward? And so stop again is stop, take a breath, observe, and then proceed with awareness. And the idea of incorporating these small stops is being able to give yourself a little space and a little pause to be able to then come back to a more mindful awareness and intention with whatever it is that you're doing right then and there. So a stop practice, could literally last 15, 20 seconds, or if you need a slightly longer pause, it could be up to, 3 to 5 minutes. And so, but just allowing yourself a moment to kind of re-anchor to yourself and then be able to move forward. It kind of helps us to press the reset button so that we can have a little bit more of a mindful engagement with those around us and our environment. So I thought maybe we could spend just a few minutes doing a little bit of the stop strategy. And then after we're done, we can reflect a little bit about ways in which you guys can incorporate informal mindfulness into your daily life and be able to perhaps talk a little bit about, what may be difficult with doing that and kind of troubleshooting a little bit. So let's go ahead and get, comfortable in our chairs. Feet on the ground, if possible, arms resting by you. Eyes can be closed or open. And you may notice thoughts whirring through your head. You may notice that, your body feels stiff or uncomfortable or perhaps relaxed. Let's just stop. Put a pause on your thoughts, on your actions. And just notice what it feels like to stop. For some, it may feel calming. For others, it may feel like whiplash. Just may depend on where you are today. And now take a breath. Anchor to those sensations of this breath, where you feel the breath coming in as it fills your lungs, and the breath as it comes out. And allow your mind a little space just to focus right here. And now observe. Observe any physical sensations you may be experiencing. Tightness or looseness of your muscles. Positioning of your body in your chair. Observe your emotions. And just doing a quick inventory of how you feel in this moment. And remembering that none of it is good or bad, it just is. Just going to spend a moment labeling what you may feel. And observing any thoughts that may be running through your mind. Maybe thoughts about the future. Maybe thoughts about whether or not this is helpful or if you're doing it right. There could be thoughts about the past. As you notice these physical, emotional, and cognitive sensations you're experiencing, do you notice anything that's asking for attention? Do you notice anything that makes you feel at ease? And as you come into that connection with your body and anchor to this moment, proceed with the rest of your afternoon, your day, with awareness. After you're done here, what is going to be your next best step? What is important? What is it that you want to approach with a mindful attitude? What is it that you want to be able to keep reminding yourself as you navigate your day? Setting the intention for a mindful attitude and openness to whatever experiences may come next. All right, start wiggling those fingers and toes, shifting the shoulders, shifting in your seat, opening your eyes if they were closed. Coming back to the lightness of the room. Okay, I'm seeing eyes opening. Wonderful. So I'd love to hear feedback from our folks today on how they might try to incorporate this stop method, or what activities they may wish to approach with a mindful attitude. Just to be able to brainstorm and maybe serve as inspiration for others.
And while we take a few moments just to let people type in a response, I wanted to ask you, Dr. Rush, how this could benefit our community of people living with Parkinson's disease. Taking a few moments out of their day to use this mindful pause technique. Could you just talk a little bit how it could benefit us?
Sure. So I've found that for many of my folks who are trying to manage their Parkinson's symptoms day to day, depending on how intense and pervasive some of their symptoms are, many people find that they sometimes get tunnel vision around their Parkinson's, and that much of their life revolves around the experience of Parkinson's, the symptoms they're trying to manage, and being able to still somehow balance living their life. And so what I see mindfulness is in being helpful with, especially with being mindful with these different activities that you may do day to day, is being able to see the activity for what it is and experience it, because it's so easy to say, oh my gosh, these things take twice as long for me to do half as much, and people get very frustrated, or they get disheartened because they can't do them as well as they used to, and they get kind of wrapped up in some of these really difficult emotions that then kind of keep them stuck in that place. And so being able to be mindful with an activity and not judging it, and just being with it and noticing other things about it other than how the Parkinson's specifically affects it, can sometimes help to balance the scales.
Thank you. We have quite a few people sharing how they're going to start using the stop method. Bobby writes to us and she says, or he says, this can be used anywhere, thanks. Annie says, I want to be more mindful when I enjoy my morning coffee, which I'm sitting here enjoying my afternoon coffee because I didn't get to my coffee this morning. So thanks, Annie, for that tip. And then Monica says this is a very helpful acronym to remember. She says she's going to try and use it when she finds that she's rushing through things. And I think with Parkinson's disease, this method is even more helpful, because when we are rushing, those physical symptoms start to manifest. Your tremor gets a little bit worse, or your shuffling gait, or you find yourself freezing in the moment of walking stride. So taking those moments to stop and just take a breath, observe, and then proceed can really help us be more efficient, right?
Yeah, absolutely. Yeah, that's how, and in fact, a lot of our physical therapists here end up working with our patients when they notice that they're getting stressed or they're getting frustrated with a certain exercise. They'll just say, okay, let's time out for a second. Let's regroup, and they'll kind of engage them in a similar kind of exercise to just kind of get them to reapproach with a slightly different attitude and be able to just be with their body and where it's at. And often they find that it helps tremendously. So I love when I'm reading some of these of people saying that they want to use it when they're on walks and doing some physical engagement. I think it's a wonderful opportunity to use the stop method.
Yeah. I'm just reading through some of these.
I know.
So Denise says, stop is helpful when rushed or stressed. Brenda says, smile more. Loss of 1 hour is a gain of stop practice today. Take a breath, open your eyes and pause.
Yeah. Pause patiently. I like that.
Pause patiently, yes. Beautiful. You know, and I was thinking, as I was practicing with you guys, how oftentimes, you know, in remote work, you're constantly plugged into what's happening in the email, what's happening online, what's happening on the phone. And for a community where we're trying to cultivate these mindful techniques, I just want to thank you, Dr. Rush, for reminding me as one of the lead hosts for Mindfulness Mondays that it's okay to take a few minutes to stop so that we can reset the brain, reset the body, especially for those more challenging, say, projects, tasks, or things that are being asked from me or from us here in our community. So just taking a moment to stop, take the breath, observe what's happening in the body or the mind, and then proceed. So did everyone write down the STOP acronym in our journals today? Lots of head yeses. Perfect. So Dr. Rush, you want to close us out this time? I know I usually say the final words, but why don't I let you do it?
Sure. So thank you again all for joining us today. And I really hope that, you know, this idea and this acronym can be of use to you this week and carry you forward with your mindfulness practice. And you know, we'll be back each Monday to discuss more and more techniques to help reinforce your practice.
Great. Thank you, Dr. Rush, and thank you all. I will see you guys March 28th with Dr. Catalina McInerney. See you then.